I am Dr. Jerrol Thompson, an infectious disease specialist. I'm inviting you every week to join our program, Healthy Choices, Healthy Actions, a health program that you need to see.
It's Conversation with the Governor of the ECCB on SVG Television this Thursday, 15th September at 8 p.m. Join me, Dion John, as I engage the Governor of the Eastern Caribbean Central Bank in discussion on developments and prospects for St. Vincent and the Grenadines and other current issues including regional air connectivity, how the ECCB protects your interest at commercial banks, renewable energy, digital economy, and what the ECCB is doing to promote youth development. You're invited to be part of this live conversation. Call 784-493-9861. You may also send a message via WhatsApp to 784-493-9861 or via the ECCB Connects Facebook page or YouTube channel. Conversation with the Governor of the ECCB this Thursday, 15th September at 8 p.m. on SVG Television. Also catch the live stream on ECCB Connects and VC3 Facebook page and YouTube channels.
Welcome to Healthy Choices, Healthy Action. I am Dr. Jerrol Thompson, and this is episode 1. And in this first episode, we are looking to talk about a disease that's actually quite common, that can affect a lot of individuals anywhere in the world. And we're going to discuss the subject of a stroke. And the question that is, I'm supposed to ask, what is a stroke? What really is a stroke? Well, I want you to understand that inside your head, inside your skull, is your brain. And your brain is one of the vital organs of your body. And your blood supply, where your heart pumps, it pumps blood up through your neck into your head to supply your brain. And if for any reason that blood supply is stopped or diminished or slowed down, blocked in some way or the other, then your brain cannot receive the nutrients and the oxygen that it needs for the cells of the brain, the tissue of the brain, to function properly. And you will see that the blood supply coming from the heart is pumped up through some big veins in your neck, on either side of your neck, the two of them. And it branches to supply other parts of your face, your eyes and so, but the main reason for this blood supply going up into your head is to supply your brain. Now, what really is the function of the brain? Well, I tell you, the brain, different parts of the brain have many different types of function. Some parts of the brain deal with speech. Other parts deal with your motor function. Some deal with taste. Some deal with memory and reading. And other sections of the brain deal with other things. Each part of the brain serves a very important function. And if the blood supply to that part of the brain, let's say that deals with speech, is affected or stopped, then you can lose your ability to speak or understand speech. Or if a section of the brain that deals with raising your arms is affected, then you may lose the ability to use your muscles and raise that arm. These are very important things. So a stroke can happen to anyone at any time. And the big question is, what really causes strokes? The important thing to understand is that there are two main types of strokes. And we have to get back into a discussion on this, but I want you to understand very clearly that when you have blood vessels that supply the brain, and inside those blood vessels you start to get deposits of fatty tissue, cholesterol, it starts to narrow the blood vessels and you start to have something called an ischemic stroke. This means that the amount of blood going to the brain is diminished, and so we call it an ischemic stroke. On the other hand, if the blood vessel taking blood to the brain in some way snaps or breaks or bursts, just like a water pipe might break, then the blood starts to leak out of the blood vessel into the brain. And the blood leaking out causes its own damage, but at the same time, the blood, if it's leaking out, is not getting to that part of the brain that it's supposed to supply. So additionally, the brain starts to lose the function of that part of the brain where that blood vessel was taking blood, oxygen and nutrients too. So that's like a double whammy. So the two types of strokes where the amount of blood trying to get to a particular part of the brain is somewhat blocked or in some way reduced or diminished, and another type of stroke where we call a hemorrhagic stroke, in which the blood vessel just bursts and leaks, and blood leaks out causing damage, but at the same time blood is not reaching to the source of where it's supposed to reach. When we return from the break, we're going to be talking about those risk factors that causes a stroke.
It's Conversation with the Governor of the ECCB on SVG Television this Thursday, 15th September at 8 p.m. Join me, Dion John, as I engage the Governor of the Eastern Caribbean Central Bank in discussion on developments and prospects for St. Vincent and the Grenadines and other current issues including regional air connectivity, how the ECCB protects your interest at commercial banks, renewable energy, digital economy, and what the ECCB is doing to promote youth development. You're invited to be part of this live conversation. Call 784-493-9861. You may also send a message via WhatsApp to 784-493-9861 or via the ECCB Connects Facebook page or YouTube channel. Conversation with the Governor of the ECCB this Thursday, 15th September at 8 p.m. on SVG Television. Also catch the live stream on ECCB Connects and VC3 Facebook page and YouTube channels.
There are a number of important risk factors. Many you would have already known about. The important ones are high blood pressure, hypertension as we call it. And this mainly comes from hypertension that isn't being treated at all, or hypertension that is poorly controlled. The second thing is diabetes, sugar. Again, there are a lot of people who don't even know they have sugar. They don't know they have diabetes, or those who have diabetes which is being poorly controlled. These are two big high risk factors for strokes. And then there is heart disease. I'm talking about persons who have bad heart disease, whether the heart is too big or whether the valves in the heart are too narrow, or more importantly, if the rhythm of the heart, the way the heart beats, is abnormal. These are big risk factors. And then there's smoking. Smoking, the smoke of cigarette has a tremendous amount of substances in them that not only cause cancer and other conditions, but they also help to stimulate the plaques being laid down in blood vessels. They cause blood vessels to become seriously affected by plaques and deposits inside the blood vessels, causing them to become narrowed. And then you all know there's high cholesterol. These are fatty tissue, fibrofatty tissues that are either made in your body or that comes in your diet, that also are deposited on the lining inside the blood vessels. When this happens, it builds up and narrows the blood vessels. There's also condition such as that causes mini strokes called a TIA. They call it a transient ischemic attack. It's called as a mini stroke. If you've been having mini strokes, it's a big risk factor for these type of things. These are the main conditions, but we must place emphasis on the issue of individuals who have heart disease. The rhythm is just not beating right. It's beating too fast, or it's beating too slow. All these conditions are usually conditions that are quite treatable. They're all treatable. Now, there are some conditions that are not so treatable, such as somebody's age. As you get older, the risk for a stroke actually increases. Can I say that after the age of 55, for each decade, in other words, from 55 to 65, your risk of a stroke starts to double. Then from 65 to 75, it also doubles. Again, so that age is a factor. And then ethnic conditions. We found that people of color are at a higher risk of strokes. This may be because earlier in their lives they were not paying strict attention to their diet, or that they live in conditions where they don't have the best sort of medical care along the way, to doctors to keep reminding them they have to do the right thing, they have to do things properly. Or even when they have a stroke, how do they get a prevention from having a second and a third stroke? The condition, where they live, if they live near to a hospital, all these factors are very important. And I must say that men have a higher risk of having a stroke than women, but surprisingly, women tend to succumb to a stroke much more quickly than a man if they do get it. All these important risk factors are important. Well, after the break, we again will come back and we'll talk about what can you do to prevent yourself from having a stroke.
conversation with the governor of the ECCB on SVG Television this Thursday, 15th September at 8 p.m. Join me, Dion John, as I engage the governor of the Eastern Caribbean Central Bank in discussion on developments and prospects for St. Vincent and the Grenadines and other current issues, including regional air connectivity, how the ECCB protects your interest at commercial banks, renewable energy, digital economy, and what the ECCB is doing to promote youth development. You're invited to be part of this live conversation. Call 784-493-9861. You may also send a message via WhatsApp to 784-493-9861 or via the ECCB Connects Facebook page or YouTube channel. Conversation with the governor of the ECCB this Thursday, 15th September at 8 p.m. on SVG Television. Also catch the live stream on ECCB Connects and VC3 Facebook page and YouTube channels.
Before we get into how we prevent it, I want you to understand what are the symptoms of a stroke. We know that if you have weakness in one side of your face or your arm or your leg, or you have difficulty walking, you got to watch this. In addition, what about if you have problems with your vision? If you start having blur in a vision, double vision, or if you start having what they call as being a slurring of the speech or understanding what someone else is actually saying. There can be dizziness. It can be problems with your balance and coordination. People could actually faint, and fainting is quite common to the extent that persons could actually become unconscious and even within a short space of time die. When oxygen cannot get to the brain cells are likely to start to die within minutes. And so it's important that these symptoms are recognized, and there's a kind of a word we use to alert you when something is seriously wrong. We call it FAST, F-A-S-T. FAST means F. If you're seeing a drooping of the face, that's number one. Number two, if you see the arm, a person's arm, you ask them to lift up their arm, one arm can't lift up. One arm can lift up good, and somebody could even press it and it won't go down, but the other arm, they can't raise it up. And then S is speech. If the speech is slurred or the person can't understand. And T means time. Time to call the doctor, the clinic. You got to call a clinic, a polyclinic, a hospital near you. If you can get that person, or if you can find yourself, if you're the person having the stroke, get to the doctor in time, then there are some treatments that we could actually give you. First of all, before the treatments are given, they have to make a proper diagnosis. Usually, they will do a CAT scan or an MRI, and these are tests that are able to show imaging of your brain and tell us exactly where a stroke is located. And the MRI is a real excellent tool. We should be seeing one in St. Vincent very shortly. There are other tests, such as an ultrasound of your neck to see if you have plaques or blockage in your blood vessels on your neck. There are tests of your heart. We do a cardiogram to see if your rhythm is running too fast or too slow. And we also do an echocardiogram, a sound test of your heart, a special sound test to see, it's almost like an ultrasound of your heart, to see if your heart is large, or if the chambers, the valves are blocked, or if there's clots inside the heart itself that are being released. We look at all these things. The most important thing is by getting to the doctor early, we can actually give you treatment, medication that could thin the blood instantly and dissolve the clot busting medication. We have medications that can actually help to reduce swelling of your brain if there's bleeding. Sometimes it may require surgery. I'm talking about them cutting into your scalp if you've had a bleed, to suck out that blood, to prevent that blood from crushing and squeezing your brain if the blood builds up inside your brain. All these things are being done here in St. Elizabeth, and the issue is time. So when you look at a stroke, FAST, look for the face, look for the arms, look at the speech. If any of these three things are the main symptoms, time to call the clinic, the doctor, the polyclinic, the hospital, and get you to the patients so one of these treatments could occur. When we come back, we're going to talk a little bit about rehabilitation and how you can recover, and kind of recap and do a summary of this whole thing.
It's Conversation with the Governor of the ECCB on SVG Television this Thursday, 15th September at 8 p.m. Join me, Dion John, as I engage the Governor of the Eastern Caribbean Central Bank in discussion on developments and prospects for St. Vincent and the Grenadines and other current issues, including regional air connectivity, how the ECCB protects your interest at commercial banks, renewable energy, digital economy, and what the ECCB is doing to promote youth development. You're invited to be part of this live conversation. Call 784-493-9861. You may also send a message via WhatsApp to 784-493-9861 or via the ECCB Connects Facebook page or YouTube channel. Conversation with the Governor of the ECCB this Thursday, 15th September at 8 p.m. on SVG Television. Also catch the live stream on ECCB Connects and VC3 Facebook page and YouTube channels.
This video will help you understand what a stroke is and the risk for having one. Normally, blood vessels called arteries carry blood to the brain. The brain needs a constant flow of blood to get the oxygen and nutrients it needs to work properly. During a stroke, also known as a brain attack, blood flow to part of the brain has stopped. The most common type of stroke is called ischemic stroke. It can happen in an artery where a fatty substance called plaque has made the artery narrow. In one type of ischemic stroke, called a thrombotic stroke, the plaque can break apart and form a blood clot that blocks the flow of blood to the brain. In another type of ischemic stroke, called an embolic stroke, a blood clot forms in another area of the body and travels through the bloodstream. If it reaches an artery near or in the brain, it can block the flow of blood. When an artery to part of the brain is blocked during a stroke, oxygen and nutrients in the blood can't get to those brain cells. The cells start to die within minutes. A less common type of stroke is called a hemorrhagic stroke. It occurs when a weakened blood vessel breaks open and leaks blood into the brain. This blocks blood flow to the brain, and the leaking blood puts pressure on the brain tissue, which damages it. In a transient ischemic attack, or TIA, a clot blocks the flow of blood to the brain. But it's different from the other types of stroke because the clot breaks up after a short time. Transient ischemic attacks usually don't cause any permanent damage. High blood pressure is the main risk factor for any type of stroke. Other risk factors include diabetes, certain types of heart disease, smoking, high cholesterol, and having previous transient ischemic attacks. It's important to know these signs and symptoms of a stroke. A sudden numbness or weakness in your face, arms, and legs, especially if it's on one side of your body. Sudden confusion and trouble speaking or being unable to understand others speaking. Sudden trouble seeing out of one or both eyes. Sudden dizziness, loss of balance, or being unable to walk. And a sudden severe headache.
If you have a stroke, with the right treatment, persons can recover. Sometimes, depending on the extent of the stroke, how large it is, which part of the brain has been affected, it can leave some residual, it can leave back some sort of effect. Sometimes an arm may be weak, sometimes you may have difficulty walking. But it all depends on how large the stroke is, how big the stroke is, and how quickly you were able to get to the hospital in order to possibly receive the right treatment. When the doctors make a diagnosis, whether you've had an ischemic stroke, where the blood is not reaching your brain because the blood vessels are blocked, or if the stroke is from a bleed, where the pressure is being high and it has burst that blood vessel, or you've had something called an aneurysm, a little bobby on top of that blood vessel that has popped and burst. It is important that rehabilitation is effective. And today, with rehabilitation and all these other things, we have been able to prevent persons from having a stroke. Another important thing is that if you've had one stroke, there's a chance that you can have a second stroke. Of course, we have to make sure the high blood pressure is well controlled. We have to make sure the sugar is controlled. We have to make sure your heart doesn't have any irregular rhythms again. We have to make sure your cholesterol is down. If you're smoking, you have to stop smoking. And you can't be around secondhand smoke either. And you can't do anything about your age. And you can't do anything about your ethnicity. But the important thing is that you could really dig deep and start to change your diet and your habits and your exercise profile so that you can make sure you don't have another stroke. The ultimate thing, though, is how to prevent the stroke in the first place. Yes, we want to prevent a second stroke and a third, but you have to prevent the first stroke. And so, with that, you need a lot of lifestyle changes. What I'm pointing out today, everybody, is that, once again, there are these blood vessels that go up into your neck. And if you have a blockage of these blood vessels deep inside your brain, there's going to be some part of your brain that's not getting the sufficient amount of blood that's bringing the nutrients and the oxygen that the brain cells need in order to function properly. And you need your brain functioning properly. What is important is that high blood pressure, diabetes, high cholesterol, heart disease, smoking is curtailed. The best way is to make sure that you're eating the right types of foods. We will probably discuss this on another occasion in terms of what are the type of foods that you need. But in this episode, we're trying to talk about identifying what is a stroke and being able, whether it is your mother or father or it is yourself, being able to pick up very early when you're having those symptoms such as leading to stroke. A stitch in time can save 9. Whether it is getting to the doctor early or earlier in your life, making sure you have changed your lifestyle, your habits, bad habits, and certainly adopting some good, excellent, healthy habits. It's really a matter about healthy choices and the healthy actions that you are taking to ensure that you are the best version of you. We are going to be back every week talking about a different topic on VC3 TV. I want you to join us and to listen and learn, because this could really change your life. The show is going to be on VC3 TV, it's going to be on Facebook, it's going to be on a number of other platforms, and you can send us any question you want on this topic or any other topic that you feel you'd want us to discuss on healthychoicesha@gmail.com. healthychoicesha@gmail.com. This is Dr. Jerrol Thompson, looking forward to seeing you next week.
It's Conversation with the Governor of the ECCB on SVG Television this Thursday, 15th September at 8 p.m. Join me, Dion John, as I engage the Governor of the Eastern Caribbean Central Bank in discussion on developments and prospects for St. Vincent and the Grenadines and other current issues including regional air connectivity, how the ECCB protects your interest at commercial banks, renewable energy, digital economy, and what the ECCB is doing to promote youth development. You're invited to be part of this live conversation. Call 784-493-9861. You may also send a message via WhatsApp to 784-493-9861 or via the ECCB Connects Facebook page or YouTube channel. Conversation with the Governor of the ECCB this Thursday, 15th September at 8 p.m. on SVG Television. Also catch the live stream on ECCB Connects and VC3 Facebook page and YouTube channels.